Hey, it's Robert, and you're watching episode 2 of our Fast Frames mini-series on aging and care. In this episode, we're discussing how to build support for our care workforce. In order to build a society that fully supports all of us as we age, we must build support for the workforce providing that care. Unfortunately, care work is often misunderstood. The majority of the public is not familiar with the level of skill that's required to do the job and the working conditions that can enable quality care. So how can we communicate in ways that build an understanding of the kinds of systemic changes we need to support care workers? Here are 3 things we can do. Number 1, emphasize direct care as skilled work, not just work done by caring individuals. People characterize good and bad care work based on the personality traits of the care worker. But when we talk about the skills that are required for this kind of work, we are in a better place to make the case for better pay and working conditions for care workers. For example, try to refrain from describing care workers as angels or overemphasizing their nurturing personalities. Instead, talk about how skilled they are at providing care and give specific examples of that skill in action. For example, the ability to identify a resident's needs and preferences and ensure proper care based on those preferences is a skill and should be talked about as such. Number 2, talk about care as an enduring collective good, not just something we need in response to a crisis. During the height of the COVID-19 pandemic, our public discourse involved a lot of war metaphors. For example, we talked a lot about frontline workers, but this type of framing can be limiting and even harmful. Soldiers at war are recognized for their bravery in dangerous conditions, but care workers shouldn't have to face unsafe and unsupported conditions, whether there is a pandemic or not. War is also a temporary crisis, just like pandemics are temporary. We want to make sure that even when we're not in a crisis, care workers are seen as central to healthy aging. Number 3, identify solutions. Although many people acknowledge care workers as essential and valuable, most do not understand what can be done right now to support them. To show that change is necessary and possible, you might call for policymakers to recognize that care workers need jobs that reflect their skills and experience through higher wages, better benefits, and pathways that enable career development over time. Communications should always include a solution that is specific and feasible.